My presentation is on anomia, a characteristic of aphasia. Aphasia is an acquired communication disorder that hinders an individual's ability to process verbal language, which means aphasia is a problem with words. Primary signs of this disorder is difficulty in expressing oneself when speaking, trouble understanding speech, and difficulty with reading and writing. This deficit in verbal language is not attributed to any other problem the patient is experiencing. It is not because they cannot hear or see well. The problem with words is because the area of the brain that serves words is damaged, usually caused by a stroke, and most often affects the left hemisphere of the brain. Depending on the brain damage, the degree of severity can vary greatly between writing, reading, speaking, and listening. A person suffering from aphasia might have a different degree in listening than in speaking, reading, and writing. Damage to the front part of the brain can cause choppy or non-fluent speech. These people can usually understand what people say fairly well. Damage to the posterior regions of the brain often have fluent speech. The rate and rhythm of their speech may sound normal. Unfortunately, when they speak, they may contain the wrong words or made-up words. In addition, these people have a hard time understanding what is spoken to them. The one characteristic that all people with aphasia share is anomia. A person with anomia has problems finding the words he or she wants to say. Every type of aphasia has a problem with word finding, varying in different degrees. How we retrieve our word depends on two stages or levels of processing. The semantic level, where the concept is connected to an abstract level representation of the idea. From an internal or external stimulus seen in this figure, it is a viewed object. Corresponding set of semantic features are then activated in our semantic system, which results in conceptual representation. This representation is then connected to an abstract lexical representation referred to as a lemma, which identifies the target word but not to its phonological form. The lemma can result in either spoken or written output and includes information about the grammatical syntactic elements of the word. In addition to activating the target lemma, the conceptual activation also connects to their lemmas with shared semantic features such as furry, four-legged, feline. The lemma that corresponds to the target should receive the greatest amount of converging activation. This lemma produces activation in the corresponding phonological representation in the second level of the model. In the phonological level, the lemma is converted into a phonological description of the word. Information contained in this phonological representation includes the sound, syllable structure, and stress patterns for the target represented as a pattern of activity across phonemes. A clinician who will work on a word retrieval deficit will have many treatment options to consider, and those decisions may be based on a number of factors, such as the etiology of the neurologic processing underlying the deficit. Impairment that stem from degenerative diseases will be managed more conservatively than those related to acute conditions in which recovery may be anticipated. Also, training intensity. Research shows that intensive aphasia, a treatment, has a greater effect on noun retrieval compared to a non-intensive treatment phase. Word retrieval treatment can be classified into two types of methodologies, restitutive and substitutive. Restitutive treatment puts patients in enriched language environments that helps patients relearn language in a way that is compatible with normal language processing. The first treatment that I will be speaking about evaluated the effect of therapy using orthographic and phonological cues on word retrieval in the long term. There were 4 participants with aphasia completed the study. All the participants were at least 1 year post-onset of stroke with word-finding difficulties as a significant aspect of their aphasia. There were 2 phases which lasted 8 weeks. The first phase, where phonemic and written cues were used to improve word findings in traditional picture naming tasks. And the second phase enabled the participants to use the treated words in situations more closely to real life. The graphic therapy incorporated showing a picture to name, and if the patient was not able to name it or made an error, they were exposed to the first sound or letter of the word with 1 or more distractors. Targets and distractors were matched for syllable structure, but differed in terms of the first sound and vowel. target cues, and distractors appeared in randomized order. The procedure for the phonological condition is identical to that outlined above. Instead of seeing the written letters and words, the person was exposed to spoken cues. The results demonstrated a significant effect in treatment in phase 1 and 2 for 3 out of 4 of the patients. Gains made in picture naming as a result of treatment were maintained by all 3 at 2 months after the end of the second phase. When looking at the differences in responses to phonological versus orthographic treatment, neither form of the treatment was more effective than the other. In conclusion, 3 participants had improved in their word retrieval following each phase of the treatment. Substitutive methodologies are different from the normal word retrieval processes by engaging alternative cognitive systems to enhance the word retrieval processes. The second treatment looked at the relationship between novel word learning ability and therapy outcomes as measured by naming of treated and untreated items. It explored how treatment intensity and neuropsychological measures may relate to individual novel word learning ability and therapeutic outcomes. There were 30 participants who were assigned to 2 groups. Before treatment began, the participants were assessed on language skills and were administered 3 novel word learning sessions. Each participant completed 48 hours of aphasia therapy. Intensive group therapy treatment delivered over 3 weeks and treated group over 8 weeks. Results show improvement in naming accuracy for treated items in 23 out of the 28 participants and were maintained in 19 out of the 27 participants. Improvement in naming accuracy for untreated items in 8 out of the 28 participants and was maintained in 6 out of the 27 participants. Moderate positive correlation between novel word learning ability and therapy gains for treated items immediately post-therapy. No significant correlation between novel word learning ability and therapy gains for treated items that follow up and for untreated items immediately post-therapy at follow-up. Additionally, lexical semantic ability and aphasia severity were only variables significantly correlated with therapy gains for treated items at 1-month follow-up. Therapy intensity did not influence treatment outcomes. In conclusion, at the group level, there was positive effect of treatment on word retrieval. However, at the individual level, there was a variable response to treatment. These results suggest that the novel word learning ability may contribute to the initial acquisition of treatment gains in anomia rehabilitation. From a clinical perspective, assessment of novel word learning abilities may help to identify a patient's potential improvement. In conclusion, treatment for aphasia is not curable. A person can recover some or most of their skills by working with a speech-language pathologist. Anomia, a characteristic of aphasia, can have positive prognosis. People with word-finding problems have been able to recover without outside professional help. In more severe cases, people with anomia will work with a speech-language pathologist in order to retain their words. A number of approaches to the rehabilitation of anomia have been described in the literature with many positive results, although no treatment guarantees that a patient will fully recover, but can most likely improve.